Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5, as well as the professionals who work with them. I'm your host, Dr. Stephanie Dueger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies and children from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Hello, and welcome back to Prepared for Parenthood. Today, we'll be talking about something that affects millions of parents, but something that's also misunderstood, under-discussed, and often just missed entirely: perinatal mood disorders. This is an umbrella term that includes mental health conditions that occur during pregnancy and throughout the first year or more after birth. We're discussing perinatal mood disorders today, or PMADs, because in our latest episode on the Prepared for Parenthood podcast, our guest, Katie O'Toole, author of Mayday on the Mothership, was generous enough to share her own challenging experiences of postpartum depression and anxiety. And here's something important to know right away: these conditions are not rare. In fact, research shows that PMADs are the most common complication after childbirth, affecting roughly 1 in 3 to 5 or 1 in 7 parents. So if you have struggled during pregnancy or after your baby arrived, you're definitely not alone, and you didn't do anything wrong. So what are perinatal mood disorders? PMADs include a range of conditions. And while we often hear most about postpartum depression, the reality is much broader. Let's take a clear look at what these can include. And I want to just invite you to, as we're talking about these, just take a breath as we're going along, because it can be a lot to digest, and you may hear yourself in these situations. Let's start with perinatal depression. So this is one of the most common complications of pregnancy and postpartum, which again affects 1 in 3 to 5 or up to 7 people. It can look like persistent sadness, but often it doesn't look anything like that. Some parents describe feeling numb, disconnected, irritable, flat, or just unlike themselves. There may be a feeling of guilt, low energy, difficulty bonding with their baby, or a sense of heaviness that just doesn't let up. This isn't a reflection of your love for your child. It's a treatable medical condition. Let's talk about perinatal anxiety next. It's actually just as common or even more common than depression, affecting up to 20% of new parents. It often shows up as constant worry, racing thoughts, difficulty sleeping even when baby sleeps, intrusive, fearful thoughts, or a feeling that something might go wrong at any moment. Some parents describe it as their mind never turning off, always scanning for danger, even in a safe situation. Perinatal obsessive compulsive disorder, or OCD, affect an estimated 2 to 9% of parents, and can include more consistent, intrusive, unwanted thoughts, sometimes about harm coming to the baby, paired with intense distress and efforts to neutralize those thoughts, like checking, counting, or avoiding certain situations. But what's important to know is that these thoughts feel disturbing and not at all aligned with who the parent is. Then there is perinatal bipolar disorder, and a little less than 3% of pregnant women will have their very first bipolar disorder experience when they are pregnant or postpartum. For those who are already diagnosed with a bipolar disorder, this can be a time of increased vulnerability during pregnancy and postpartum. Research shows that without treatment, relapse rates of bipolar disorders can be as high as 50% or more postpartum. Symptoms include periods of depression, along with episodes of elevated mood or what we might call mania, a decreased need for sleep, racing thoughts, impulsivity, things like that. Careful monitoring and support during this time can make a really profound difference. Then there's perinatal PTSD, or post-traumatic stress disorder. It's often connected to a traumatic birth or prior trauma that was not resolved. And studies estimate that it affects about 3 to 6% of birthing parents, with rates higher in high-risk situations. It may look like intrusive memories of the birth, nightmares, avoidance of reminders like sirens, or a persistent sense of threat. There may be a heightened startle response, trouble sleeping, or increased sensitivity to things that may not have bothered you before. And for some, even just medical settings or conversations about the birth can feel very activating. Finally, there's postpartum psychosis, which thankfully is rare. It occurs in about 1 to 2 out of every 1,000 births, but it is a medical emergency that requires immediate care because it can spiral down very quickly. Symptoms can include confusion, disorganized thinking, hallucinations, delusions, or rapid mood changes. It often emerges very quickly in the first days or weeks postpartum, but on even more rare occasions, it can show up prenatally, especially when it's related to some medications. With prompt treatment, recovery is possible, and early support is essential. So let's take a gentle pause right here. That's a lot of information to take in, and some of it can feel kind of upsetting for people. If you've heard yourself in any of those descriptions, even just a little, I just want to share with you the mantra from Postpartum Support International, which is a wonderful organization that has done so much to support women and professionals about PMADs. Their mantra is, "You are not alone, you are not to blame, and with help you will be well." So why do PMADs happen? There isn't just one cause. Instead, research consistently shows that perinatal mood disorders emerge from a combination of biological changes. For example, pregnancy and postpartum involve dramatic hormonal shifts, including estrogen, progesterone, and stress hormones, which influence brain systems that also regulate your mood. Psychological factors, a history of anxiety or depression, high stress, or even perfectionism can increase someone's vulnerability. But often people have no history at all of mental health issues. And then there are social and environmental factors, a lack of support, relationship issues, financial stress, birth trauma, sleep deprivation, and many other pieces can also play a role. In fact, lack of support is one of the strongest predictors of a perinatal mood disorder like depression. So why does this all matter? Perinatal mood disorders don't just affect the parent. They also influence bonding and attachment, infant development, partner relationships, and the health of the whole family. And yet, many parents are reluctant to reach out because they feel like they should be able to manage it on their own, or they may feel afraid or even ashamed of how they feel. So the good news is these conditions are highly treatable, and research gives us clear guidance on what actually helps. First of all, early screening really matters. Identifying symptoms early leads to better outcomes. Just like with anything else, the earlier you catch it, usually the better, the easier it is to treat. Tell somebody how you feel. Have other people who are watching out for you, because you may not see it yourself. Answer screening questions at your doctor's office honestly. No one's going to try to take your baby away. The objective is always just to help you and your family thrive. We know that support is protective, like we mentioned before. Emotional and practical support significantly reduces symptoms. Support's very important for the birthing parent, but also the partner as well, if there's a partner. Sleep and basic needs are critical. So sleep, nourishment, and recovery are essential, not optional. Sleep when your baby sleeps, rest if you can't sleep, and eat healthy, nutrient-dense foods. Therapy can be very effective. Getting professional support from someone trained in PMADs is helpful and often essential. This may be individual support, but it might also be group support, which can be highly effective as well. Medication is sometimes indicated for moderate to severe symptoms. Treatment options are available to be discussed with your doctor and can be used safely with proper guidance. And finally, just reducing shame around any mental health condition is really powerful. Being heard and supported without judgment can be really healing for the parent who's having a hard time adjusting to new parenthood. So have a gentle reframe for you. Instead of asking, what is wrong with me? We might ask, what kind of support does this season of my life require? And here's a final thought. The perinatal period is one of the most profound transitions a human being can experience. It stretches the body in a multitude of ways. It reshapes your brain and nervous system. It asks more of you than almost any other season of your life. And it asks more than one person can sustainably carry alone. So if you're struggling, it doesn't mean you're failing. It means you're a human being in a moment that requires care, support, and understanding. And those are things you deserve. Thank you for being here today. If this episode resonated with you, please consider sharing it with someone who might need to hear it. I'd like to end again with the refrain from Postpartum Support International regarding perinatal mood disorders. You are not alone. You are not to blame. And with help, you will be well. I look forward to seeing you again soon. Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.